Hi, I'm Materia, an 8th semester student of the bachelor degree in biology pharmaceutical chemist at the Faculty Chemical Biological Sciences, belonging to the Autonomous University of Campeche, and I will talk to you about the gastric cancer. It is known that around 50% of cancer incidence in the world is caused by several biological agents such as viruses or bacteria. For example, colon cancer is related to the Streptococcus bovis, lung cancer to the Chlamydia pneumoniae, and gastric cancer to Helicobacter pylori. It's a disease characterized by the development of tumoral cells in different parts of the stomach. It normally starts at the innermost layer of the stomach, which is the mucosa, and then it spreads to other layers. As the disease spreads, it can turn into metastatic cancer by moving through the bloodstream and reaching other important organs such as the liver, lungs, and bones, making the disease even worse. Histologically, two distinct variants of gastric carcinoma are identified. The first is diffuse type gastric cancer, consists of individually infiltrating neoplastic cells that do not form glandular structure and normally affects young people. The second is intestinal type adenocarcinoma, which is initiated by turning normal mucosa into chronic superficial gastritis, then atrophic gastritis, and finally leading to adenocarcinoma. Almost 1 million cases of gastric cancer are diagnosed each year, establishing this disease as the fourth most common cancer worldwide. During 2002, more than 900,000 cases of gastric cancer were registered in the world, and around 77% of the patients died. So, it is very lethal disease. In Mexico, gastric cancer is the fourth cause of death in men, and the fifth in women. During 2002, out of a total of 18,000 causes of gastric cancer, 6,000 people died. This disease is difficult to diagnose in early stage, since most patients are asymptomatic or symptoms can be confused with any other suffering. In early symptoms, we have abdominal pain, nausea, heartburn, and loss of appetite. In later symptoms, we have loss of weight, yellow skin, difficult swallowing, blood, vomit. There are many risk factors involved, for example, diet, high consumption of grain food, and low consumption of fruits and vegetables can affect. Bad food preparation, high consumption of tobacco, chronic gastritis, and infection by Helicobacter pylori. Helicobacter pylori is a gram-negative bacterium that has a spiral shape. Its dimensions are around 2.5 to 4 micrometers large and 0.5 and 1 micrometers weight. It has a smooth cell wall covered by glucocalyx and around 2 to 6 flagella. It is a microaerophilic bacterium. It means that it needs oxygen to live, but in lower concentration than those found in the atmosphere. The flagella and its spiral-shaped help the bacterium to drill the stomach mucosa and stick on it. In 1994, Helicobacter pylori was recognized by the World Health Organization and the International Agency for Research on Cancer as a carcinogen type 1. How does Helicobacter pylori contribute in the cancer development? There resides many bacterial virulence factors that play an important role in the development of cancer by Helicobacter pylori infection, such as the CAGA protein, peptidoglycan, and DACA protein. This protein translocates into host cell after bacterial attachment. Once inside, CAGA is tyrosine phosphorylated and interacts with several intracellular effectors, inducing cell morphological change, for example, promoting cell elongation. Non-phosphorylated CAGA can activate beta-catenin, interact with E-canderin, and other cell receptors and proteins, leading to pro-inflammatory and mitogenic responses, disruption of cell junction, and loss of cell polarity, which can promote cancer development. Peptidoglycan interacts with the host cell molecule NOD1 and activates pro-inflammatory responses. Peptidoglycan also activates other signaling pathways associated with an increased risk and developed gastric cancer. For example, instant activity protein leading to decreased apoptosis and increased cell migration. BACA can suppress T-cell responses and contribute to the longevity of infection. It also induces disruption of gastric epithelial barrier, function and modulation of the inflammatory response. There are very few molecular tests related to gastric cancer. The exact ones only help to determine if immunotherapy can be helpful treatment. For example, there is the PD-L1 test that indicates how much of this protein is present in tumoral cells, and microsatellite instability tests can also be made. However, there is a test based on PCR in order to diagnose if Helicobacter pylori is present in biopsy sample. Treatment. The main ways to treat stomach cancer are surgery, chemotherapy, targeted therapy, immunotherapy, radiation. There are treatments to relieve symptoms and side effects and treatment to keep cancer under control for as long as possible. Some drugs used are fluorouracil, leucoyovorin, epirubicin, cisplatin, y docetaxel. Conclusion. The risk to develop gastric cancer increases with an infection by Helicobacter pylori. It is a lethal disease that needs more investigation in order to have more molecular tests that help to diagnose it more easily.